Hi, everybody. Thanks so much for joining us today for this webinar. It's just so great for you to take the time out to learn a little bit from all of us at Hiawatha Valley. So I just want to introduce Hiawatha Valley Mental Health Center. Is just a mental health center here to just serve you in several communities. So if you're in need of any mental health services, please contact us at 1-800-657-6777 or online at HVMHC. If you're experiencing a mental health crisis of any kind, or you need any kind of services for a mental health crisis, or if someone you love is having a mental health crisis, you can call 24/7 at 1-844-274-7472. And again, just feel free to reach out at any time if you need supports or services, especially during this time. This presentation is going to last about 20 to 30 minutes, and then there's going to be some time after. If anybody has questions, feel free to put them in the Q&A box, and I'll try to get through as many as we have time for at the end. And that time could be up to 20 or so minutes. So I just want to thank you again for coming, and I hope that you can all get something out of this time. So my name's Sabrina. I'm an outpatient therapist at the Red Wing office of Hiawatha Valley, and I work with children, families, teens, basically people of all ages. And I do a lot of parent education, and I've been working with families for about 5 years in a variety of roles as a social worker. I think one of my biggest education pieces through my life has really been being a parent. I'm the mom of a very large blended family of 10 kids. And so when I say that I really do understand some of the difficulties that come with explaining things to kids, talking to kids, especially during this time, I really do have a lot of just some knowledge and personal experience around that. There's no perfect parenting. There's no science to it. There's no playbook to being a parent to any child because every kid's different. And every kid has different needs. And so the information we're going to talk about today is useful for a variety of different ages. And you can kind of pick and choose what's useful to you and your family. But one thing to keep in mind is that every kid's different and your family's different. So you're really the expert on your own kids and your own family. And so just if you pick up information that's useful and apply it to your life, just be really flexible with that information and know that it might apply differently than the way that I'm sharing it with your own family. Today we're going to be really touching on communication. And communication is really tough right now because we are just getting so much communication coming. And so what we're really going to talk today is how parents can really get the best, most accurate information without getting overwhelmed, and then how to tell your kids about what's going on so that they can manage the stress. We know that there's just a lot of increased anxiety and stress, especially in kids and families right now. And so just how do you communicate with your kids, and then how do you handle all of the communication that we're getting? We are constantly inundated with words from everywhere we look. Lots of it is pretty scary and confusing. We're hearing, just all of this stuff about the virus, about, just what's happening in the world around us, the election, vaccines, and every time we turn on the TV, every time we turn on the radio or open our phones, we're just getting all of these messages constantly. And a lot of it's really confusing because I think on one hand we're hearing from people, wear masks, that's the cure. Masks do nothing. On the other hand, there's so many extremes right now on both sides of things that everybody's sort of like getting lost somewhere in the middle. Like, what's the answer? Everybody's waiting for a vaccine. Then there's no vaccines. I think there's just a lot of confusion in this time, and we're just dealing with information overload. This guy here looks like he's getting way too much information. Information overload is real. We also call that infobesity, infoxication, information anxiety, or information explosion. And that's just really the difficulty in understanding an issue and effectively making decisions when somebody has too much information about that issue. When we get too much information, especially conflicting information, it can be really hard to know what's the truth, like what do I actually have to do? So it's important to sort of slow that down and really just try to get information from a trusted source or somewhere that you can slow some of that down. We get information from like all of these different places. And I think when you go to school, they have a message or something they need you to do for your kids. We're getting information from community events, posters, doctors, kind of everywhere. And I think every day is like a breaking news, and one of the things, the great race of Wisconsin and Minnesota, like who has more COVID numbers, every time you turn on the news. And I think it starts to get very stressful and causes a ton of anxiety. I know I've got friends who are like, I wear a mask, I very rarely leave the home. And then I've got friends who are like, I'm not wearing a mask. And so I think we get a lot of information and messages, even from people that we trust in our lives, that, we want to believe a lot of different things. And so I think there's a lot of places that this stuff comes from that we really have to sort through carefully. One really simple strategy that I used was I'm making a big assumption that the Center for Disease Control, or the CDC, really knows what they're talking about. They really have all of the best scientists, doctors, and information out there, and they're going to give us the most accurate current information that they have. So I just Googled the CDC coronavirus guidelines, and it popped up right in Google of what it is. COVID-19 is most commonly spread between people who are in close contact through respiratory droplets or small particles. And it just really explained that growing evidence, which indicates that they're going to give us more information as they know it, shows that droplets can remain suspended in the air and travel sometimes beyond 6 feet. So indoor environments with poor ventilation increase that risk. And so it just really says, like, that's really how it's spread around. And then some very simple steps. This is what every family needs to really do to keep safe. Wash your hands regularly with soap and water. Maintain at least 6 feet distance. Avoid touching your face. Cover your mouth and nose when coughing. Stay home if you feel unwell. Refrain from smoking or other activities that weaken your lungs. And practice physical distancing whenever possible by not traveling or staying away from large groups of people. I think when we cut it back to just the very simple information, it feels like, okay, I can do those things. I can follow those steps quite easily. Other ideas that I've used myself is call your primary physician and ask, what are the basic things that I need to do to keep my family safe, especially if you've got a high-risk family member, a child with asthma or personal issues with health. Make sure you're calling your primary physician and saying what extra steps or what steps are most important for me, so that I can live my life the best that I can while still staying safe. I also, kind of at the beginning of this, when we didn't have a lot of information and it was just a very stressful time, I called my sister-in-law, who's a public health nurse, and she'd been reassigned to track COVID numbers. And I just asked her, I said, what are you doing for your family? And she explained that she's doing the steps the CDC recommends, and she's living her life as normally as possible. And so she really just reassured me that if I take these action steps, I'll remain safe and really likely be just fine. Another thing to just kind of know is the numbers in your area. If they're going up exponentially, this might impact your desire to go out to eat or go to stores, or you might take extra precautions and be more careful or more aware of social distancing if you're seeing numbers going up in your area. Using common sense is really much more simple when we've got information from trusted sources, and it's like not as confusing if we're not listening to all of the really right-wing, left-wing extremes. Being flexible is super important. Information changes day to day with schools, with all of the different stuff going on right now. So just remember to be flexible and kind of just prepare yourself for this information to change. And just trust your instincts as a parent and as a person. Like if you feel like it's safe, you feel like you can put parameters in to keep yourself and your kids safe, make those judgment calls with the best information that you can. I think as we go through all of this, we now kind of have some information, and now we have to talk to our kids. How do we tell our kids about COVID-19? And one of the first things I always think about is really, how are you doing? How are you managing the stress of all of the stuff that's been going on? And really just doing a self-inventory, checking in with yourself. Am I calm? Do I need a break? Am I doing all right with my own mental health, so that I don't communicate my own stress to my kids? As you can see, I kind of picked this picture because she's explaining to a younger child. She's really getting down to his level and really doing some comforting to him. So she seems more relaxed, she's calm. And so I think really some of this self-care at this time in our lives is probably more important than ever before. Make sure you're in just a good place to talk to your kids without passing on anxieties or fears. Self-care is really important. So there's just simple things that you can do in 5 minutes, just simple things. There's, find a cute video, listen to a song, do something that you've been putting off, do mindfulness or breathing, drink some water, get some fresh air, or write down some things about yourself, just some little 5-minute self-care tips. I think some other things that you can do is talk to somebody you love about how you're feeling, reach out for support if you're feeling depressed or anxious, and just remember that managing your own feelings helps your child manage theirs. When they see that stuff happens in life, they see how you respond to that, and they see the stress that you're under and could become more stressed themselves. So just check in with yourself before having conversations and focus on positives. There's always something going well. I think just keeping in mind that you can take your kids to Panic Town or to Calm really, really quickly. An example of this, I recently heard a parent she was feeling very anxious about COVID-19 and very well-intentioned. She called her daughter and she said, I have something to share with you, and I'm so sorry. I know this is really, really scary, but your friend is getting tested for COVID. And I'm so sorry, and I know you're so scared, and I know this is really scary. And I think I heard her say, I know this is really scary 3 to 4 times. And in her sweet, well-intentioned way, she really put her daughter into a state of panic. Her daughter began to worry that her friend was going to be very ill and really have everything happen to her that she'd heard in the news or in other places. So remembering when we send messages to our kids that the alternative to telling your kids this is really scary is saying, hey, you know what? I just want to let you know you can't play with your friend for a few weeks because they're getting tested for COVID. And so it's important that we just try not to spread it around. So until her test comes back negative or she's feeling better, we can't play with her. It's really the same message that your friend's getting tested for COVID, but it doesn't make them scared of the actual situation. It's just different language. And so paying attention to how you're saying stuff, super important. And paying attention to your own body language, your own tone of voice, all those things is really helpful for kids of all ages. When we're talking to our kids about any situations that come up with COVID or with just life, using languages like we and all of us help children feel less alone. When I say, hey, we have a responsibility, we have this opportunity to help and make sure we're in this together. And we as a family are going to get through this, or, we can talk about that. I think using language that's inclusive like that with kids helps them to feel less stressed, less alone. I think asking a lot of questions about what they're feeling, where they're at, is super important. And I think even in a way that's not specifically related to COVID or like, hey, is everything okay? What's going wrong? Really saying, hey, what's your school doing to make sure everyone is safe? Changing that language from that negative to a positive. So what's going well that's keeping people safe instead of the opposite of that. If your child comes to you with worries or fears, make sure you don't minimize their worries or fears. Say, I understand that you're scared, but I just want you to know that there's ways we're all working together to be safer as part of the solution to recover. It really helps empower children to feel more in control. And when kids feel in control, they feel less anxious, and they certainly just manage all of the stress of all of this much better. Giving kids ways to help makes them feel more in control. So, honey, we're all doing this together. Here are some ways that you and I can help together. Just gives them some feelings of being in control. What do we absolutely need to do? I think we need to just teach children the basics. You have to keep it really simple and really practical. As most of you know, children start asking why from the minute they can talk. Kids want to know why. Adults want to know why. Why am I doing that? And so it's important to not blow off the why question, but as much as you can, answer the why. Explain what we're doing and what for, because it helps you have buy-in with your kids at their age level. So if you have a kiddo that, we wash our hands because it stops spreading germs. Older kids, you can talk about spreading the infection and what that means, but those younger kids, it's really just the symbol, we just want to keep everybody safe, and washing your hands is really important to help do that. And then when we set the example for them, if you're going to wear a mask, if you're going to be consistent and careful and social distance, your kids are going to follow, probably far more than what you say. Kids watch what you do. And so communication is really just setting that example for them. Sometimes older children or teens can be really helpful with reminders. When kids feel included, teenagers, especially when you say like, hey, can you help remind the younger ones? It really gives them some drive and some focus to do it themselves. And not all teens, I think you know your teen best. Some teens may have less buy-in than others. And just again, that same message over and over, remember to let them know we're in this together to keep others and ourselves safe. One strategy is to put up a simple picture in your home of washing hands, covering your nose and cough. Just that reminder is good for little kids. Young kids in particular are often really scared by lots going on, or really like when they don't understand what's happening. They definitely have a lot more anxiety because they just don't have the language to process or talk about it. One thing that I've used a lot as a therapist, as a mom, and just as a professional in the social work industry is something called words and pictures. And you can take this exact one off of the slide if you're able to print it, or you're welcome to make your own and create one that makes sense for your life. But what it is a storyline with pictures. And so just like we show kids pictures, it just gives them the language and the ability to understand what's going on. It goes through each section. What's going on? It's called COVID-19. A virus is going around that's making people sick. Some of you might be better artists than me. These are masks, if you couldn't tell. It talks about who's getting sick. Anyone can get sick just like the flu, but some people get more sick than others. We have to be careful so that grandmas and grandpas or people who are already sick don't get it. We shouldn't be hugging or touching others right now. And then what if I get sick? I think that's a common worry. Kids are like, what if I get sick? What happens? We get a test to check at the doctor and then stay home and rest so we don't spread it to anyone else. I think that's reassuring because it gives the what next. It just says we're going to stay home and rest until you feel better. And then that's that hopeful when you feel better. And just like moms or dads, we'll go to the doctor to check, and then we'll need to stay home and rest until they feel better. And then giving kids a task. What can I do to help? Wear a mask, stay home if you're unwell, social distance, wash your hands, and reminding kids we're all in this together. Mom and dad are here to keep you safe. We're all going to work and do our part. So I think those messages are really what kids need to know. They need to know that their adults in their world are going to do what it takes to keep them safe. So I do have a little video, and if you aren't able to hear it, I apologize. We had some technical difficulties this morning with the videos, but I'm going to go ahead and play it. It's just an opportunity. It's just a fun little video about what kids can do, and something fun to maybe watch a video with your kid. Just makes it a little bit easier to have that conversation.
Hello, everybody. It's me, Drew. The new